Hi, I am Dr. Selvaraj, your surgical educator from Malaysia. Welcome back to my series of surgical teaching videocasts. These are meant mainly for undergraduate medical students doing the surgical clerkship rotation. I promise you will become competent in clinical problem solving and surgical decision making if you are going to watch these videos over and over again. Today, in this episode, I am going to discuss one more topic on basic surgical principles, that is surgical nutrition. The learning objective of this presentation, or after watching this presentation, all of you should be able to recognize the importance of nutrition in surgical patients and what are the basics of surgical nutrition, how to assess the nutritional status in a surgical patient so that we can make appropriate supplement of this nutrition. How to do pre-op nutritional supplements, how to give preoperative nutritional supplements, and how to give post-operatively the same nutritional supplements. How to do or how to give enteral feeding that nourish the body from within, or how to give parenteral nutrition, that is nutrient support beyond the gut, that is mainly through the peripheral vein, either the peripheral or mostly central vein. And what is immuno nutrition? And what are the trace elements? The importance of trace elements in nutrition. And finally, some of the take-home messages also I have included in the presentation. So coming to the importance of surgical nutrition, the critical role of nutrition in surgical procedures cannot be overstated. How proper nutritional support before, during, and after surgery significantly influences the patient's recovery and wound healing or the outcome of the whole surgical procedure. The comprehensive understanding of how surgical nutrition can significantly impact the patient outcome. That is what we are going to discuss in this presentation. So what are the advantages of giving proper nutrition to the patients who are undergoing major surgeries? By optimizing the nutrition, it is aiding or it is helping in the tissue repair and proper wound healing. It also helps in stronger immune response, helping them to fight infections. Optimal nutrition also helps muscle preservation and aids in early ambulation, facilitating a faster recovery. Patients have the energy and endurance to cope with the demands of post-operative rehabilitation. Lower incidence of post-op complications, including SSI, surgical site infection, anastomotic leaks, or wound descents. Shorter hospital stays enhance quality of life, and often patients tolerate surgery and anesthesia better. Healthcare providers can significantly contribute to better surgical outcome if they are optimizing the nutrition to these patients. So what are the basics of surgical nutrition? The main Three sources of nutrition are carbohydrate, proteins, and fats. 85% of our energy need is provided by carbohydrate and proteins, whereas 15% of the energy is provided by fat. Carbohydrates yield 4 kilocalories per gram of this carbohydrate energy. Proteins also yield 4 kilocal per gram of this energy. Fats yield 9 kilocalories of energy. Healthy individuals needs 25 to 30 kilocalories per kg per day of energy and 0.8 to 1 gram of protein per kg per day. This is for healthy individuals. Suppose our patients are trauma patients, burns patients, or patients who are undergoing major surgery. They need more energy or more calories. So their daily need will go up to 55 to 30 kilocalories per kilogram per day of energy and 2.5 gram of proteins per kg per day. This is the basic needs of the surgical patients. How to assess the nutritional status of the patients who are going to undergo surgery. Essential, because this assessment is essential to identify individuals at risk of malnutrition and to develop appropriate strategies to optimize their nutritional status before and even after surgery. Preoperative assessment is crucial to identify potential deficiencies and plan appropriate interventions, that is nutritional intervention. You have to take medical history review that might impact the patient's nutritional status and surgical outcome. We have to get nutritional history and dietary habits. You have to do the physical examination of the patient. These are the anthropometric measurements like body weight, body mass index, mid-upper arm circumference, skin fold thickness. All these things you should do to find out the nutritional status of our patients. Biochemical markers such as serum albumin, prealbumin, hemoglobin and hematocrit also can be done to find out the nutritional status. We can also do some nutritional screening tools like malnutrition universal screening tool, or it's called MUST, or nutritional risk screening NRS 2002. By doing this test, the healthcare providers can obtain a comprehensive picture of patient's nutritional status. Early identification of malnourished or at-risk patients enable the implementation of targeted nutritional interventions. This results in improved surgical outcomes. So, preoperative nutritional supplement plays a crucial role in optimizing the nutritional status of surgical patients. Rationale for pre-op nutritional supplementation. We are correcting the malnutrition, immune function enhancement we can do. We are supporting tissue repair and wound healing. The benefits of optimizing the nutritional status before surgery are reduced post-op complication, improved wound healing, enhanced muscle strength, faster recovery and rehabilitation. The recommendations for pre-op nutritional supplements are we have to give protein-rich supplement with vitamins and minerals. The Immuno Nutrition such as arginine and omega-3 fatty acids can be given. We must also give carbohydrates to these patients. We have to conduct a thorough nutritional assessment to identify specific deficiencies, and we have to tailor-made the supplementation plan accordingly. By addressing the nutritional deficiencies and supporting the body's healing mechanisms, healthcare providers can significantly enhance the surgical outcome. Coming to the postoperative nutritional supplement, adequate nutritional support plays a pivotal role in promoting healing and reducing post-op complication and facilitating a smooth rehabilitation process. Importance of post-op nutritional support. This helps in healing and tissue repair. Proper nutrition is essential to bolster the immune response and reduce the risk of post-operative infection. This also helps in muscle preservation and metabolic support. The challenges of oral intake immediately after surgery is because of reduced appetite. Patients may have nausea and vomiting, can also have swallowing difficulties, and the bowel function for the initial 48 hours, it won't be there. Patient will be having ileus, post-op ileus. So that is also one of the problems. So we can give in this scenario post-operatively enteral nutrition supplement. So enteral nutrition involves providing nutrients through a feeding tube directly into the gastrointestinal tract, bypassing the oral route. We can initiate the feeding early in the post-op period. This reduces the complications and this will maintain the gut integrity also. There are various types of enteral feeding like nasogastric, nasojejunal and gastrostomy, which I will be discussing in one of the slides. By tailoring the nutritional support to individual patient needs, healthcare providers can significantly contribute to improved surgical outcomes. Enteral feeding or nourishing the body within. The method of delivering essential nutrients directly into the GI tract, providing much needed nourishment to surgical patients who may have challenges with oral intake. Or this is delivering a nutritionally balanced liquid formula containing proteins, carbohydrates, fats, vitamins and minerals directly into the stomach or small intestine. That is what is called enteral nutrition. There are so many routes for administration. We can use a nasogastric tube which is inserted through the nose and down into the stomach. Or this could be a nasojejunal which is inserted through the nose and advance into the jejunum. Or we can use a gastrostomy tube surgically placed directly into the stomach through the abdominal wall. This can be done nowadays by PEG, percutaneous gastrostomy tube. Nowadays we are doing. Or we can even use jejunostomy tube, that is surgically placed directly into the jejunum. What are the indications for enteral feeding in surgical patient? Number 1, inadequate oral intake, prolonged fasting in conditions like gastrointestinal dysfunction, or if we want to give early nutritional support, okay, we can start enteral feeding. What are the advantages of enteral feeding? This will maintain the gut integrity. It is cost effective, not very expensive compared to the parenteral nutrition, and enhance nutrient absorption and gut hormone stimulation. These are the advantages of enteral feeding. So potential complication of enteral feeding are aspiration pneumonia, tube dislodgement, diarrhea and constipation. Tube related complications like skin irritation, local infection, or tube itself may get blocked. Here in this side you are seeing an enteral feeding. Here they have put a nasogastric tube and you can feed it, or you can connect this tube to a infusion pump. Yeah, that also we can do it. Whereas here in this side you are seeing a parenteral nutrition where this tube is going through the central vein, subclavian vein, this side. So this is what you are seeing it. This is parenteral nutrition given through the one of the central vein. This is enteral feeding given directly into the stomach through this nasogastric tube. So this is a gastrostomy procedure where it was done not by open method but with an endoscope. This is called PEG procedure or percutaneous endoscopic gastrostomy. This also can be done for enteral feeding. Coming to the parenteral feeding, where the nutritional support is given not through the gut or the GIT, it is given through the parenteral, that is usually through the IV line. Either mostly it is central line, or occasionally we can give it through the peripheral IV lines also. This is the specialized form of nutritional support that delivers essential nutrients directly into the bloodstream when the GI tract cannot adequately absorb or tolerate enteral feeding. Parenteral nutrition is a method of providing nutrients intravenously, bypassing the GI tract entirely. Parenteral nutrition is utilized when enteral feeding is not possible, such as in patients with severe gastrointestinal dysfunction, intestinal obstruction, or those who require prolonged fasting before and or after surgery. Indications for parenteral nutrition in surgical patients: gastrointestinal dysfunction, inadequate enteral intake, postoperative complications, severe malnutrition. These are all the indications. What are the components and how to administer this TPN? Macronutrients like carbohydrates, protein and fats should be given. Vitamins and minerals also should be added. Electrolytes like sodium, potassium, calcium and magnesium should also we have to add. Trace elements like zinc, copper and selenium also should be used. Administration. TPN is typically administered through a central venous catheter or central line to ensure adequate dilution and prevent damage to the peripheral veins. If we are using peripheral veins, giving TPN, these veins will get blocked within 48 hours. And that is why majority of the TPN we used to give through the central line. What is the monitoring in TPN? Close monitoring of metabolic parameters, fluid balance and electrolyte levels is crucial to prevent complications related to TPN. We have to measure the weight, the electrolytes, and the blood urea nitrogen should be monitored quite often. Glucose also you have to do every 6 hourly. What are the complications can happen in TPN? Dehydration and electrolyte imbalances, or thrombosis can occur. Hyperglycemia or hypoglycemia also can happen. Infection, liver failure, micronutrient deficiencies like vitamin and minerals, all these things are complications. Here you are seeing a patient. This is the TPN solution which is given through, this is the infusion pump, and then the tube is going through this central venous catheter. It is going through the right subclavian vein. So you have to keep it here. And this chamber or the IV solution, it contains in 3 chambers which can be made into one by pulling them apart. Okay, you can, this is carbohydrate, this is protein, and this white one is the fat. All 3 should be, it will be separate before we are going to infuse it, but just before going to infuse this TPN solution or formula, we have to mix all these 3 carbohydrate, proteins and fat by, just opening this. This is 3 loculi are there in this chamber. If you pull it apart, this one and this one, the whole thing will become a single chamber. Then you can start giving this solution to the patient. Immuno Nutrition is a specialized approach to nutrition that focuses on providing specific nutrients to modulate the immune response and improve the surgical outcomes. Immuno Nutrition refers to the targeted provision of nutrients with immunomodulatory properties to bolster the body's immune response. It aims to support the immune system and reduce inflammation, promoting better healing and recovery. Specific nutrients in modulating immune response are arginine, omega-3 fatty acids, glutamine, nucleotides, and antioxidants. The use of immunonutrition in surgical practice. It reduces postoperative infection rates, shorter hospital stays, and faster recovery times. Enhance wound healing, improved surgical outcomes. Multidisciplinary collaboration between surgeons, dietitians, and healthcare providers is crucial to tailor-made immunonutrition regimens to each patient's unique requirements. Immunonutrition is an exciting avenue for enhancing the body's immune response and improving outcomes in surgical patients by providing targeted nutrients with immunomodulatory properties. Trace elements are essential micronutrients that play a crucial role in various physiological processes, particularly in wound healing and immune function. Importance of trace elements in surgical nutrition. It gives micronutrient support essential in small amounts but are vital for various enzymatic reactions and cellular function. It also serves as cofactors for enzyme involved in metabolic pathways. Use of immunonutrition in surgical practice reduce post-op infection rate, shorter hospital stay, faster recovery time, enhance wound healing, improve the surgical outcome. Multidisciplinary collaboration between surgeons, dietitian, and healthcare providers is crucial to tailor-made immunonutrition regimens. It is an exciting avenue for enhancing the body's immune response. What are the take-home messages? In this presentation, we have explored the vital role of surgical nutrition in optimizing patients' outcomes and fostering better surgical success. A comprehensive nutritional assessment is essential in identifying malnutrition risks and tailoring individualized nutritional plans for surgical patients. Preoperative nutritional supplementation helps correct deficiencies, enhance immune function. Adequate post-op nutrition is crucial for wound healing and muscle preservation. Enteral nutrition serves as a safe and effective means of delivering nutrients to patients who cannot tolerate oral intake. Parenteral nutrition becomes necessary in patients with severe gastrointestinal dysfunction, providing life-sustaining nutrients directly into the bloodstream. Immuno Nutrition supports the immune system and reduces inflammation. Essential trace elements such as zinc, selenium, and copper play a critical role in wound healing. Optimizing nutritional status before and after surgery reduces complication, shortens the hospital stays, and improves the overall patient outcome or well-being. So thank you very much for watching this video. If you think that these videos are very helpful, kindly share these videos with your friends and in your social media. Kindly subscribe to this channel and share this in your social media also. And please click the bell button also to get notified regarding my latest upload. Thank you once again for watching this video. Let us meet in yet another video. Until then, bye-bye.